So let's talk about signs and symptoms. So as individuals, what signs should you be looking at, or even for your loved ones that, this might be a sign of diabetes, and how, as a healthcare provider, what kind of tests and tools do you use to diagnose diabetes?
So number one, let's talk about tiredness.
Okay.
So a couple of years ago, I had 3 people come to me saying they were tired. 3 different people coming to me tired. Now, when people come to me that they're tired, I do a full workup because it could be anything. Tiredness could be lack of iron in your body. Tiredness could be due to thyroid problems.
Right.
Tiredness could also be due to diabetes. And then tiredness could be due to some other problems that you might be having, you understand me? So are you sleeping well? I mean, if you're sleeping at 2 o'clock in the morning time and you say, "Doctor, I'm tired," it's 7 o'clock. I mean, come on.
Exactly. Try.
Can you try and
try and go to sleep a bit earlier.
Try and go to sleep a bit earlier. I'm saying,
Yeah.
Or doctor, this movie, I like this series, the Blacklist, they call it, this series.
Right.
I can't miss it. I mean, I want to try and cut it up by 12, but it was so interesting. I'm going to cut it up by 1 o'clock. Come on, man. You got to cut it up by 10 o'clock or 11 o'clock, man, and go to bed and get ready for work. So sometimes that's a problem. But anybody that comes to me for tiredness, you should do a screen as well. Do a proper blood panel.
Right.
So for these 3 chaps that came to me, and it was the same month, the 3 of them came to me. Wow. Their complaint was tiredness. And I screened for them. I did the blood test. So the blood test you do a fasting glucose test.
Okay.
And you do a HbA1c. So the HbA1c measures your blood sugars over 3 months. That's very important. Yes, the fasting blood glucose level is above 7 on 2 different occasions.
Okay.
Then this is classified as that you probably got diabetes, you understand me? And then the HbA1c of more than 6.5 is diabetes as well.
Okay.
You understand me? So we send them for them. And then all 3 of them had diabetes. The same month they came to me, that was a complaint, tiredness.
Wow.
And all 3 of them had diabetes. So tiredness is a big one. So if you're tired, you got to see your doctor. You understand me? So that's number 1. Number 2, remember what I told you about the little kid that came with his mother?
Right.
Thirstiness. Being thirsty all the time could be a sign of diabetes. Having recurrent urinary tract infection, so all the time you're having an infection,
right?
Kidney infection, you gotta check, is this a sign of diabetes? When you urinate, the quantity is bigger than usual. Okay. That may be a sign. Going more frequently to urinate,
right?
That may be a sign as well. Losing weight may be a sign as well. Depending on which one it is, you understand me? Which type it is. So, you gotta, if you're having any of these symptoms, you gotta see your...
So bottom line, seek medical attention. Right?
Seek medical attention.
Because on your own, it may not be diabetes, but once you reach out, they can do all of the follow-up treatment tests.
Just once you have any of these symptoms, see a healthcare professional.
Right.
So these are the symptoms,
that you should be looking out for. So keep an eye out for those. And if you have, loved ones that are going through that, please
see your healthcare professional.
Encourage them to go seek medical help. That's one way. I know our community, we don't like the doctors, but they're there for a reason, right?
Yeah.
Okay. So of course it's a deadly disease, and there's so many complications. What are the complications of diabetes? We know it affects a lot of the organs of the body, so just throw light on those complications.
One of the big ones is heart problems.
Okay.
So when you're diabetic, you're more prone to having a heart attack or a stroke. In fact, the major thing that kills diabetes is usually the heart problems, not even the diabetes. So when we're going to medications, I'll tell you some medications that can help you help prevent some of these things. So heart attack, heart failures are common in diabetes. Okay, that's related to the heart. Stroke as well is also related to diabetes. So as a diabetic, you have a high chance of having a stroke if you're diabetic. Okay, and then the eyes. And then the eyes. The eyes, it can lead to blindness.
Right.
So as a diabetic, so all my diabetic patients, okay, I asked them, when last did you see the ophthalmologist, the eye specialist?
Right.
Get your eyes checked. Because it can lead to blindness. So you got to get your eyes checked at least once a year. And they will have a look at your eyes, the special instrument they use, and they'll blow up the images just to make sure you're not having any problems there. So that's very important. And then kidney. Diabetes can lead to kidney problems as well. So I always check the protein quantity in the urine. Okay. I must do that on a yearly basis on my diabetic patients. Now, there are some some of my diabetic patients who have had some kidney problems.
Okay.
And then I check them more frequently.
Okay.
You understand? So it depends on if you're just newly diagnosed and we check it and it's not too bad, then I don't check it. I check it every year, but I don't check it as frequently. The frequency depends on how it is with each subsequent visit investigation I do for you.
Okay.
So it's important to have that checked. You understand me? And then it can lead to peripheral circulation problems as well. You understand me? It can lead to nerve problems as well. Some diabetes get numbness.
Right.
And this is the key thing. I want to mention it. Very, very important. If you develop numbness on your feet at any time, you need to see the healthcare professional straight away. That's number one. Number two, you should not be walking barefooted. I've had patients, unfortunately, who have had their feet amputated.
It can be serious.
If you walk barefooted and then you develop an injury to your toe, to the bottom of your foot without you knowing about it, it can lead to something bigger on, and before you know what's happening, it's too late.
Right.
Before you know what's happening, it's off.
Because you don't have, you lose sensation.
Yes, you lose sensation. You don't even know it's everything. And then by the time somebody has a look at it, they'll look at it, oh my goodness, there's nothing we can do about this anymore.
So get into the habit of like assessing your feet.
Yes.
So
when I used to run my diabetic clinics, I would always look at your feet.
Okay.
I'd listen to your heart. I'll check your HbA1c, which is your average blood sugar over the last 3 months. I'll ask you about your eyes as well. I might check it as well. Just comprehensive.
Right.
You understand?
It's a key thing.
And like I said, like you want to repeat it again. If you have numbness of your feet, see your family doctor or see your diabetic specialist, whoever looks after you.
Right.
But also make sure, do practical things. First of all, put on some slippers. And also get someone to have a look at your feet as well, because you might not be able to see the back of your bottom of your feet properly.
Sure. And
if it looks like it's an ulcer developing, you need to see somebody almost immediately. You understand me?
Yeah.
Like a family doctor, get to see him sooner rather than later. But even if there's nothing, if there's nothing, get some slippers. Because once you add them to your feet, you can't be barefooted again in the house. Yeah. You'll be using slippers.
Awesome. So bottom line, just be that a habit of doing your yearly, monthly, quarterly exam. Make sure you're in contact with your healthcare provider, right? So that way, if anything develops, it can be addressed right away.